let us start talk about your early inspiration into the medical fields and how you get into to the medical fields.
Yeah, thank you for that question, Mary. You know, I was pretty much born into medicine. I was born and raised in Mexico City, and my father is a surgeon by training, but he also had a small hospital in a very poor area of Mexico City. So pretty much from the beginning, from pretty much from when I remember, I was indirectly exposed to medicine, and I remember standing right behind my dad as he was giving patient advice, just standing behind him, learning how to interact with people. And I was about 11 years old when I had the opportunity to watch him perform a surgery, and I just became enamored with medicine. And I think my love for medicine originated both from the role model and the example that I saw from my dad, but also watching the tremendous need of people in that community where they have very, very low resources, and the tremendous impact that my father and his colleagues had on helping people change their lives in what for us is another surgery, another clinic, another pathology that we're treating. For every patient is a life-changing experience. So that's where my interest came about, and then, you know, that really developed into getting into medical school in Mexico and having a tremendous amount of role models and great mentors and great teachers that basically allowed me to form my own path. And I was lucky enough to have an experience as an international medical graduate in the United States in Miami for my last year of medical school. And that really put the bug in my ear to try to further my training in the United States, which led to my surgical training at the University of North Dakota. And eventually I got a job in Sanford Health, and Sanford Health System has been my only employer for over 20 years. And it has been just a fascinating journey for me, and an honor and a privilege to be a clinician that has been able to impact lives at different levels. So that's kind of my journey, Mary.
Oh, that's very cool, wonderful. So you have been over 20 years in Stanford, representing the organizations and also talking international platform, receiving award and recognition from the medical associations and from international organization. Did that fulfill your dreams in the medical field, all this experience?
Yeah, Mary, let me tell you, Sanford Health is a tremendous organization. And of course, whether the recognitions came at the individual level or at the organizational level, what matters is, of course, the recognition that reflects the work of a team, because it's always a team approach. And that recognition goes to all the members of the team that makes something successful happen. But also reflects the tremendous commitment that we have in our patients and our communities. I don't know how much do you know about Sanford Health, but we are an integrated healthcare system that is headquartered in Sioux Falls, South Dakota. But our footprint of clinical operations is about 250,000 square miles. And we have core clinical operations in the states of North Dakota, South Dakota, Minnesota, and Iowa. We employ about 2,600 clinicians, and we have about 300 clinics and short of 40 hospitals. So it is a large system, but what we really take pride on is that we bring excellent care in a rural setting. You know, we're one of the largest integrated healthcare systems that brings care in a truly rural setting. And it also, something of pride for us is the true commitment to our patients and our communities. We make a promise to all our communities that we're going to bring excellence of care to your doorstep, and we walk the talk, and we do that. So it's just a fascinating experience. and a tremendous honor to be part of such an organization that has such a commitment to communities and patients, and fulfill that commitment through excellent care and tremendous talent that we have in our organization. I can hear you, Mary.
Wonderful for this huge, that huge. So you always talk about developing the human aspect of your staff in the organization. Tell me more about that, about what you are doing to your medical fields and or to your medical employee, and also how was that during the pandemic, when there was lockdown and the physical distance, like everything was hard. How were the medical field able to manage that?
Yeah, Mary, that is a very important question. And for somebody that is a clinician to start with, and then became an administrator and a leader in the position that I hold today, for me is very, very important not only to have the best talent in our organization, but have the best talent at its best. And what that means is that a baseline expectation is that we should support our clinicians in the clinical setting to the point that they can be very successful as clinicians. But beyond that, Sanford Health has really invested in supporting our clinicians more than just the clinical practice. Now, what that means is going back to my comment of having the best people at their best. That means support beyond their clinical activities. That means support beyond the four walls of Sanford Health. So we have created a spectrum and a comprehensive amount of programs around support for our clinicians that would allow them to ask for help and get support provided to them regardless of the situation. And that support also expands not only to our clinicians, but to their family members as well. A lot of that, Mary, became quite important during the pandemic, because one of the things that reflected into the pandemic and also continued in the post-pandemic era is the emotional stress that our clinicians went through in this difficult period of time. If you think about it, as professionals in healthcare, we get trained to take care of others, and we always take care of our patients and provide the best care that we can. But we often forget that we are also human beings. And as human beings, no matter how well trained you are, you have difficult days, you have difficult times in your life. You deal with the same stressors as any other individual. So as a physician or as an APP or as a nurse or any sort of healthcare provider, you do have also situations of stress in which you deserve to be supported. And the pandemic highlighted a lot of that. What you see as a result of the pandemic is that the level of burnout for our clinicians, the level of disengagement, and even the incidence and prevalence of depression and even suicide attempts in the medical field have risen to levels that we have never seen. And that has continued post-pandemic. So it is of utmost importance that we see our clinicians as such, as human beings that have basic needs like anybody else, in addition to the support that they need for their clinical success. And we have in Sanford invested tremendously in resources and funding to satisfy that need for our clinicians. And as a result, Mary, we have a very unified medical group that is very proud on once again delivering tremendous care in the Dakotas and beyond. One of the things that I forgot to mention, Mary, is that we do have an international presence as well through our world clinics, which you alluded to. And, we have a presence of 8 countries around the world, a huge operation in Africa, in Ghana, particularly. And we're so proud to extend that reach of a well-integrated healthcare system in countries around the world and in communities that truly need that help, like is the case of Ghana.
In the case of mental health, the topic that you have talked about previously in many international platforms, what has the medical field done abroad on that in general? And what was like Stanford mission to address the mental issue, the mental health issue, especially for vulnerable group like women and young people?
Yeah, mental health is something that is highly pronounced nowadays for Sanford and for all entities that are in healthcare, and not only for adults, for also children and vulnerable populations, as you point out. And the reality, Mary, is that the prevalence of all those mental conditions have increased, as I mentioned earlier. But yet the resources that we have at our disposals have not increased and developed at the same level. So what you see is a challenge because there is a disengagement between the resources that you have available and the need. So there is a problem of access to care inside the United States and beyond. And if you look at countries outside of the United States, that gap between access to care and need for care is significantly higher than in the United States. So as an organization, you obviously need to focus on how do you retain the staff that you have that is currently providing the services. How do you maintain them in a situation where they can maximize their talent, but also what do you do to increase that pipeline of training psychologists and psychiatrists that would come into the field. So Sanford Health has done a tremendous investment in medical education that includes psychiatry and psychologists as well. The other thing that we have looked at is how do you change the delivery of care? If you think about it, a lot of the mental health issues that we see nowadays are through primary care clinics. And the primary care physicians oftentimes do not feel equipped to have those conversations or do not have the resources available to support the patients. So you have to change the models of care. And one of the things that we have done in Sanford is, for example, introducing IHTs and BHTs, which are behavioral health therapists, into the primary care clinics. So they collaborate with the primary doctors conjointly as we address these needs. So it's a combination of increasing the pipeline, retaining your staff, creating an environment for success to the staff that you have, and changing your delivery model of care that altogether starts creating a difference. But to be honest, Mary, we have a huge shortage of clinicians for the demand that we have in mental health. I can't hear you, Mary.
How can we fix the gap between the shortage of the staff on the mental care system to fill that gap? How can we fill the gap to have more employees, especially in the medical field?
Yeah, it is, as I mentioned before, Mary, it's a challenge. The gap is a challenge, but we have been very successful at identifying opportunities to close that gap, as the examples that I mentioned just earlier. Of course, there are things that are under Sanford's control and on their individual control, which is what we have been trying to change. And there are other things that are not directly under Sanford control, but we can continue to be advocates for. So we have a tremendous advocacy team that it is trying to create an influence not only at the state level, but at the national level to elevate the importance of these topics to make sure that we get more support at the state and federal level. So as I mentioned before, Mary, there's not one thing that is going to create a solution to a very complex problem. It has to be a combination of programs, factors, activities, and opportunities that we are engaging on to try to satisfy that gap.
Okay, so one of your mission to work in international policy, and I think also Stanford has worked in one of the projects in Ghana, the Adenta project. How do you envision the future of such projects, especially in Africa?
Yeah, Mary, that's a great question, and of course, what we are concentrating right now in Ghana is on the core problems, healthcare problems in the population of Ghana right now. You know, Ghana is a very interesting country, and it's not going to be. It's a very important country for the future of Africa. You know, the economy of Ghana is strong, and the healthcare conditions are switching from the infectious diseases as the cause of mortality to more of a chronic disease statement as a cause of mortality. So in other words, in very, very poor countries in the world, what you see that is killing people is things like infectious diarrhea, dehydration, things like that. While in more industrialized countries, you see things like diabetes, stroke, coronary artery disease, because the basic needs are satisfied. And Ghana right now is in that transition. So for us, it is a combination of supporting those conditions depending on where our clinics are. You know, we have clinics where we are treating the very basic conditions, and there are clinics that we are providing very complex delivery of care. And in collaboration with the Ghanaian government and also with the tertiary referral centers in Ghana, we have been able to be very successful at a lot of things. As an example, we have one of our surgeons traveled to Ghana a couple of times last year to treat complex neurosurgical conditions. And one of the ones that took a lot of attention was a situation where they were conjoined twins that needed to be separated, and our neurosurgery team had the opportunity to work with teams from the United Kingdom and the local teams in Ghana to separate those conjoined twins. So it just gives you a perspective of how we are trying to give help to our operations in Ghana from the very basic standpoint all the way to complex medical care.
Is there any are there any African countries that the clinic has vision to work with?
Right now, we're concentrating in Ghana, Mary. We have a lot of opportunity in that country. And of course, you know, if another opportunity arises in which we can have a similar impact, we'll look into that. But for now, we're concentrating in Ghana.
Mm-hmm. So just a question, you have done your residency in the University of Miami. You also choose South Dakota and North Dakota. Why did you choose the Midwest?
Yeah, and just for point of clarification, Mary, I did my last year of medical school in Miami. But my residency was at the University of North Dakota. And why did I choose the Dakotas and the Midwest to establish my practice? It's very simple, Mary. A tremendous quality of healthcare and tremendous communities. You know, the quality of life, the quality of people in our communities, and the ability to deliver excellence in care is very prominent in the Midwest. So it was very easy for me to engage in that setting and truly create a difference. So in almost 25 years of career, Mary, I can tell you it has been nothing than an honor, a privilege, and a joy to bring surgical care to the communities in need. And in a more selfish way, it has brought to me a tremendous amount of satisfaction and professional development. So I would do it again. Sanford is a great organization. The Midwest is a great place to execute on your talent. And I welcome any of the clinicians that are interested in developing a great career to contact us, and we'll be happy to recruit you into the Midwest.
Thank you. I think I have a great question that, like, what is your advice to young people that were looking to get enrolled, like to find to start a career in the medical field or study medicine?
Yeah, Mary, my advice is to follow your passion. The medical field is the most honorable profession that you could have. It is a field that allows you the opportunity to help people coming to you with tremendous need and trusting you with their greatest asset, which is their health and their lives. And that is a tremendous privilege and a tremendous honor that comes, of course, with a tremendous responsibility as well. But, God gave us this talent. And if you want to execute on that talent, once again, it's a tremendous honor. Follow your passion, help people. There's always somebody that needs you. There's always a life to change. And if you're interested in the medical field, it's something that will always stay with you and will always bring that satisfaction to you more than any other profession from my perspective.
Okay. So you work in 2 different countries. You have experience working in Mexico